Hello, my name is Dr. Marlene Merritt, and the other day I was reading this article online, and it was titled something like, this woman was talking about how she'd seen 50 doctors and they had no diagnosis, and she was just gonna, it was like in the subheading, like she was just gonna learn how to live with what she had. And it just broke my heart. And I was thinking to myself as I was reading, I was like, I wonder if I can figure this out. So I was reading through this, and it sounded super familiar. And what I'm actually thinking was going on was something that we see in our office. Like, you may be somebody who has this, in the sense that she had all this crazy testing done. You know, every nerve thing, rheumatoid arthritis thing, autoimmune stuff. They had done all sorts of things. They had given her like partial diagnoses. They were kind of guessing at what the diagnoses were. But most importantly, at the end of all that, there was no treatment, right? There was no chance of getting any relief. There was no like time that she was going to not feel miserable. And that was the thing that was really the hardest. That was the thing she was trying to live with. And, you know, this is what I would say. If you are somebody who is dealing with something like that, where you've been to, like some of our patients have been to the Mayo Clinic, they've been to Cleveland Clinic, and they didn't know what was going on there either, then consider like it's maybe just the doctors haven't seen what you have. Or that if you've actually gotten diagnosed with something like chronic fatigue syndrome or fibromyalgia or autoimmune that doesn't sort of behave like a normal autoimmune disease, that like maybe that's the wrong diagnosis. Because one of the things is that your complexity is part of the description, because you probably have more symptoms than just the area they're looking. Like, they'll take those symptoms down, like they'll write them down, but they can't actually figure out like why you have brain fog, you know, or why you've got chronic pain problems, or why you also have sleep problems, if they even asked about that, or why you have like chronic acid reflux that doesn't seem to get better with medication, you know, or why you've got these weird skin rashes and you can't figure out why those are there, why those don't get better no matter what you do with those, even when they give you steroids. And I want you to consider something. I want you to consider that they don't have the right diagnosis, that they have pieces of the puzzle, and what you really need is to be able to see, like, if you have a diagnosis of something that's more systemic, something that's not dealing with symptoms, but is actually a whole system problem. And if somebody could back up enough to see if what was going on with your system, you might know what was happening. So this is the thing. I think that perhaps what's going on is something called chronic inflammatory response syndrome. I actually wrote an email to this woman telling her that she should look into that. Because if you have chronic inflammatory response syndrome, you have a multi-symptom, multi-system problem, right? So you've got a whole bunch of different things that don't seem related to each other, that are actually related to each other, but mostly doctors are seeing like the individual specialty. You see a pain specialist, you see a GI specialist, you see a sleep specialist, and all of them like, no, or maybe there's a little something there, but they can't really answer everything else. So this is the thing. You have something else going on that covers all of those things. And it might be chronic inflammatory response syndrome. And there's a very easy screening process for us to do to see if this is what's happening, and then we can confirm that with actual blood tests and, you know, scientific tests that show that this is what's happening. So if you are somebody who has seen a ton of doctors and you still feel miserable and nobody has any idea what's going on with you, please call us. We might be able to figure it out.